on behalf of the Cellular Therapy Consortium in the United States, which constitutes of 8 academic institutions in the United States, I presented the data on late hematotoxicity after CD19-directed CAR T-cell therapy. We looked at the prevalence. It was quite prevalent at 1 month, 2 months, through 12 months. We looked at the cytopenias grade 3 and higher by CTCEA criteria. At 1 month, there was about 29% cytopenias. At 2 months, there was still a good number, like 15% of the patients had cytopenia. At 3 months, it was 12%. At 6 months, 10%. At 9, 12 months, it was 4%. And then even at 12%, still 3% of the patients had clinically significant cytopenias. And we looked at the associations between cytopenias and outcomes. And while there was we weren't able to, find any association with age, multiple, prior lines of therapies, ICANS, CRS, bridging therapy. The only factor that was associated with late cytopenias were high hematotox score, basically, both at 3 and 6 months. And when we looked at the survival data, patients who had cytopenia, their overall survival was not different from those that did not have, but looking at the non-relapse mortality, those patients who did have cytopenia actually had higher, significantly higher non-relapse mortality than those without cytopenia. And most of the mortality was driven by infection. About a third of the patients died from infection. And so basically, this is a real world setting that we still see that cytopenia is probably the most prevalent toxicity of CAR T-cells, and we need studies to understand the pathophysiology of the late cytopenias and manage these cytopenias based on the pathophysiologies.